Hey, Dr. Henry here again. I wanted to tell you a little bit about something that we call the Austin Knee Clinic. So the Austin Knee Clinic is actually inside TexStar Chiropractic, and what it is it's our specialty practice focused exclusively on knees. We opened it about 2 years ago, and what we've really done is gone above and beyond to try to find some alternatives for traditional knee care. We have brought in some specialized equipment, done some specialized training, and I'm going to tell you a little bit more about that later on. So we originally started the Austin Knee Clinic because we saw that there was a lack of non-surgical, non-injectable, and pharmaceutical knee care available. And what I mean by that is that traditionally when you have knee pain and you go to an orthopedist, if you have degeneration in that knee joint, then you're recommended either a steroid injection, sometimes a hyaline cartilage injection, or knee replacement. Those are kind of your options. There's physical therapy as well, and we do a little bit more of that, but generally it's going to be medication or a surgical or injectable fix. And the success rate with those isn't fantastic. So what we wanted to look at is, hey, what about these other people? These people that maybe aren't ready for surgery yet, but still have knee pain that's chronic and debilitating. So what we wanted to do was to come up with some ways that we could approach that kind of care. So we dug deep into some knee training and did some extra learning basically on, hey, what are some knee conditions that respond really well to non-surgical care? And when we got into it, it's the majority of knee conditions. Honestly, until a knee is just so degenerative that it can't be saved, then surgery should be our last option whenever possible, aside from trauma and things like that. I'll show you a little bit what I mean. So this is a knee joint. This is a deeper view. This has just the bones, the ligaments, and the cartilage. And what you've got are these ligaments that run up either side, and then an ACL and a PCL, and those are what stabilize the knee front to back. Now, if you tear one of these ligaments completely, that's a surgical situation. But say you just have some damage to one of these ligaments and we need to strengthen the muscle tissue around them. That's where physical therapy and chiropractic and conservative care like we come in and provide. The other thing we see a lot of, and this is probably the vast majority of knee pain patients that we see, is pain along the inside of the knee or along the muscles in the leg around the knee. It's not actually knee joint pain. And there's a big issue with differentiating that, because if you can restore the normal balance of the muscle tissue around here, you can go in and release the over-tightness, the inflammation, these tendons, and the knee pain resolves itself relatively quickly. So you can save a lot of people from ending up getting surgery, because if you have degeneration and you have this, well, the main approach is going to be to go in and replace the knee or resurface the knee, and a lot of these folks end up not needing to do that at all. So that's what's really kind of exciting about what we're doing here at the Austin Knee Clinic. So I just wanted to tell you a little bit about kind of our approach. We're here to try to provide options that are non-surgical, and we have a really high success rate with that. We try to really dig down to the root cause. So if you're having muscle imbalances that come in because your hips are offline and you're walking on sideways and there's something wrong with your feet and ankles, so we kind of evaluate the whole lower half of your body whenever we treat a knee pain patient, as opposed to just zeroing in right on the knee, because I think you miss a lot of other things going on when you get so focused on one area that's painful. So we try to take a whole body approach, really go and dig in and figure out what's causing the problem and the pain. And then when we do have degenerative issues like that, we do have some therapies here in the office that we'll have several videos coming out later this month that will kind of go over the different therapies we use to treat degenerative conditions non-surgically. And so I'm going to show you right now one of the ways that we can rebalance a muscle. And so I'm going to take you to another video right now of me actually treating somebody to release the muscle tension along those muscles here on the side of the knee. Thanks. All right, so one of the ways that we work on knee pain when there's a muscular imbalance is we go in and we do a treatment called trigenics. And to do that, we actually lengthen the muscle while we are having the patient activate and fire the opposing muscle. And in doing that, we're able to get quite a bit of relief and rub the muscle tension around the knee joint. So I'm just going to demonstrate that real quickly. So Maggie, if I can have you go ahead and push your foot down toward the table, I'm going to come through here and I'm going to release the popliteus muscle behind the knee. Push again. And Maggie's done this many times, so she's pretty quick. Normally, we may give you a little bit more instruction as we go. I'm going to have you push down against my knee here, so go ahead and push, 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 push. And I'm going to come through, and I'm going to come through the hamstring. And I actually felt that just start to stretch, so that's great. So we're looking for, yeah, you can always hear it with Maggie because there's a lot of degeneration in her knee. So Maggie, I'm going to ask you to go ahead and roll over and face up. Great. And so we treat Maggie's knee pretty regularly just to try to keep things moving and feeling good and avoid having to do any kind of more invasive procedures on that knee. So it's more of a preventative thing we do with Maggie now. So I'm going to have you come on over here. I'm going to have you go ahead and pull that heel down toward the table. Right. Awesome. Okay, so we're loosening right here below the kneecap. Now I'm going to work the IT and the adductor muscles. So go ahead and pull that heel towards your buttocks. Great. That one's tight. We're going to go through there a couple of times to try to release that IT. And one more. And last one. Great. Okay. You doing okay?
Yeah.
Great. I'm going to have you go ahead and pull your heel down toward the table. So just like that. I'm going to come across the knee. Good. All right, can you come on up for me? I'm just going to have you go ahead and stand up on that knee. And I'm going to get you balanced. And then just give me a little squat down. Let me know how that feels compared to where it was a second ago. Yep, you got it. So just go ahead and squat down for me and tell me how that knee feels compared to where it was a second ago.
Oh, it's not cracking. The other one's cracking.
Now we have the other one working. But is that feeling better, worse, the same?
Oh, better.
Okay, great. Okay, very good. Thank you.